answers here, so please feel free to post a question if you have one. If not, listen to the questions that I've got, because fortunately I've got some. I was a bit panicked there. I thought I didn't have any questions then, but of course I have. Tidy up there. So what we got? We have got a question here. Now, where are they? I know where they are. Here we go, 14th. There we go. Amy's in the house and Corinne is in the house. Good to see you both. Could I talk about hypertrophic scar? Yeah, I think someone posted this question, and I think I said to them, can you tell me what specifically you want me to talk about? And they didn't get back to me. So there you go. I will talk in general terms about hypertrophic scar. So hypertrophic scars are red raised scars, lumpy scars, unsightly scars, abnormal scarring. And there is a spectrum. And on one end of the spectrum, you've got a totally normal scar, flat and skin colored. And on the other end of the spectrum, you've got a keloid scar, which is a very florid, very raised, it can be quite extensive scar. And hypertrophic scar is sort of along that spectrum. And it's slightly debatable whether it's actually keloid scar is a separate entity or if it's just part of the spectrum. But keloid scars traditionally extends outside the boundaries of the original scar, whereas a hypertrophic scar stays within the boundaries of the original scar. Hypertrophic, they can look similar in the early stages. Hypertrophic scars are usually self-limiting in that they get better on their own, but they can take about 18 months to get better. They're often red, raised, and itchy. Both of them can be that. Hypertrophic scars can be due to delayed wound healing. So if you get an infection or a delayed wound healing, particularly if your wound takes longer than 3 weeks to heal, which is one of the reasons, one of the criteria we use to treat burns. If you have a burn, sometimes you have a very superficial burn that's going to heal up no problem. Sometimes you have a very deep burn that's definitely going to need a skin graft. The problem comes with the intermediate burns, which are going to heal, but they're going to take time to heal. And if they're going to take more than 3 weeks to heal, then we worry that would give you a hypertrophic scarring. So we don't really treat burns anymore. But anyway, we, as plastic surgeons, we would normally arrange to see you back at a week, maybe 2 weeks, to have a look how well that burn's healing. And if it looks like it's not healing so well, it is a case of grafting it, because the scar is going to be better if we graft it. But crikey, how do we get onto that? Oh, hypertrophic scarring, yeah. So hypertrophic scarring is scarring which is due to delayed wound healing and infection and self-limiting. And the treatment is similar with hypertrophic scarring and keloid scarring in terms of massage. Is this first instance, then silicone can help, which can come either as a gel or a sheet. The sheet is usually better if you could keep it on. So if it's on the breast or on the body, often the sheet can stay on. If it's on the face or the ear or something like that, the sheet will just fall off. So the gel's better in those areas. And then steroid injection, and lastly, scar revision. But we would really use scar revision as a last ditch, because often these things are caused by the way your body heals. As I say, if there was obvious reason for it to be hypertrophic, for instance, if there was delayed healing, then we'd be more likely to revise it surgically than if there was no obvious reason for it to become hypertrophic. If there was no obvious reason, then the worry is it's your body's response to scarring. And so if we revised it and gave you another scar, it might be just the same. So that will be taken into account in the history. But so if there was no obvious reason for it, then we would be very anxious about revising it surgically, because we could give you another hypertrophic scar. So that will be the last ditch of treatments. So yeah, talking a bit about hypertrophic scar. Douglas, the Christmas jumper on your next live Q&A. I've just realized what next is going to be 7 plus 4, 21. So definitely, I mean, I can't believe I'm not wearing one tonight. Well, look at me. I mean, I'm not prepared. I think you can probably tell that. Hair's a mess. I don't have my hair done. Almost look like I'm balding, you know, to the untrained eye. I mean, there's clearly quite a lot of hair there, but just a bit untidy. God, it looks, look how long it is. Anyway, yeah, I can't believe it. Can I wear Christmas jumpers after? Anyway, yeah. Yeah, Defo Douglas. I don't know what I'm doing next Tuesday. I mean, God, am I going to be here next Tuesday? Tuesday before Christmas? Am I going to be here doing this? Probably am, you know. What kind of life is that? Last life for me before the big day. I know, Corinne, big day. A lot of stresses going on about the theatre and stuff. It's all looking like it's all okay in terms of all this corona thing, but it is bubbling up, isn't it? Yeah, Corinne, big day. 6 sleeps, 5, I don't know, anyway, 6 day, anyway, whatever. Yeah, good. Hypertrophic scars. Can you wear a Christmas jumper on Monday? No, I can't, Corinne. I've got to look professional. I know I don't look very professional here, but I've got to look professional. I'm not going to wear a Christmas jumper to work, the theatre, am I? I don't know if it'd be sterile. I think Christmas scrubs. Do we offer rhinoplasty? One word answer, no. I tried to base the clinic, and I'm trying to, you know, build the clinic on excellence, and my area of excellence and expertise is in breast and body contouring, so it's not in face. So rhinoplasty is one of those ones which is really difficult, and you have to know what you're doing with rhinoplasty. So we don't offer rhinoplasties. We don't offer non-surgical like Botox, fillers, etc., etc. As I expand the clinic and get other surgeons working with me and things, it might be something that we will be doing. But at the moment, like for instance on this, if you ask me a question about rhinoplasty, tip this and cartilage that, and you know, spread a graft and goodness knows what, I'd be quite frankly lost. So you know, that's why I don't want to dabble in it, because a lot of people do dabble in plastic surgery and all bits and bobs all over the place. A lot of people do a bit of everything, and I don't. I just do breast and body. So breast and body questions, I'm okay with those, but yeah, we don't do rhinoplasty. So oh my god, my friend had a boob reduction today. She's absolutely over the moon. Look at that. That's the sort of live reactions we want from Ali. Nicholas, good to hear. Did you tell her that you recommended her? That's the thing, because you know, no cost if patients are recommended. No, we don't charge consultation fees. Hope all my patients know that. After having a breast augmentation, how long do things take to settle? I'm sure I've asked that. I'm sure I've done that. Have I not done that? Well, again, short answer, 1 year. Longer answer, wounds healed in about 5 days, 5 to 7 days. So you'll have a dressing on for about a week. Once the dressing comes off, the wound's usually healed, the skin's healed, so you don't need a dressing after a week. But the skin, the sort of underneath of the skin and the scar and all that takes a few months for it to sort of get to strength. So you don't want to be doing anything too active for probably the first couple of months. To get the wound knitting together. The shape looks wrong to start with. They're up here and all sorts. I normally say the sharp stage starts to settle about 3 months, starts to settle, and takes about 6, 12 or 18 months for it to really properly settle. So 12 months is where things are really starting to settle, I would say. But you'll have an idea on the way, but you know, that's the ballpark. Highly recommend JS is the best. Yeah. Come on. Bloody good of you to say. Haven't forgotten me. I haven't seen you in a long time. Is areolar reduction included in a breast lift? Yes, it is. So when you do a breast lift tightens the skin around the breast. And when you're tightening the skin around the breast, you, as well as tightening the skin, you're moving the nipple. You're moving the nipple from a low place to a high place. So that is an integral part of a breast lift. A breast lift and a breast reduction, answering another question, are the similar operations. A reduction makes them smaller, whereas a lift keeps them the same size. So they're the same operation in that they're reducing the skin envelope. The reduction just reduces the volume as well. But both of them reduce the skin envelope and move the nipple. And when you're moving the nipple, you can make the nipple smaller. And you often, I say the nipple, being a bit slapdash with my terminology there, areola to be Pacific. The nipple is actually the bit in the middle that sticks out. The areola is the pigmented bit of skin around the outside. So it's actually the areola that we reduce as part of a breast lift. And it is normal to reduce it a bit, and I'll occasionally people say they don't want their areola reduced, which is fine. You don't have to have it reduced. You can have it the same size. But often the reason you need a breast lift is because the breast skin has been stretched. Not always. Some people are born with the shape of the breast they don't like, but often people need a breast lift because the skin has been stretched. Two things that do that are children and weight loss or weight gain and then loss, stretching the skin, and the areola being part of the breast skin gets stretched with that breast skin. So the areola is often larger than would be in proportion with the breast, particularly when it is tightened and lifted. So it's very common and unusual to do an areola reduction as part of a breast lift, and you certainly don't need to pay for it. You don't have to pay for an areola reduction. That's actually an integral part of it. What you got, Louise? Louise, on 3 weeks post-op, is it okay to use bio-oil on my scars, or do I need to wait 6 weeks? Nothing written in stone, Louise. It depends on how well they've healed, particularly at the T-junction. Sometimes the T-junction can be a bit at 3 weeks. I don't know. I mean, if it's completely dry, if you're wearing bras, or when you take your bra, you've got no dressings on, and you take your bra off, and there's nothing on the dressing, then there's probably no harm in gently going for it. What I usually do, Louise, is I normally at 6 weeks, things not only have healed well, but they've got a bit of strength to them at 6 weeks. So at 6 weeks, we actually talk about massaging your scars, giving it a bit of pressure, making them blanch, which at 3 weeks is probably a bit early for that, because I think it's not quite knitted together strongly. So I would, if you want to put stuff on your scars, yes, you can put stuff on them, but I wouldn't go too much on the massage side of things. And it's really actually the massage that actually helps the scar rather than the stuff. A lot of people rate bio oil, vitamin E, aloe vera, Nivea, all sorts. People use all sorts, aqueous cream. And I don't think there's any evidence to say that one thing's better than another thing. But actually the massage is good. So actually the vehicle for the massage doesn't matter quite so much as actually giving it a bit of pressure. But at 3 weeks, I think giving it a bit of pressure, Louise, is a little bit too soon. So I would, if you want to put stuff on, fine. If your skin's going dry and things like that, that's fine. If you want to moisturize, no problem. But I wouldn't go too crazy on the massaging. I'll catch up with you at 6 weeks, and then I'll talk to you about giving it a bit of pressure and trying to break down that scar tissue, because you'll feel often at 6 weeks, the scar tissue actually feels firmer than it does at 3 weeks. So maybe sometimes at 3 weeks it doesn't feel too bad, but at 6 weeks, as it starts knitting together, it feels a bit more firm, a bit more sort of rope-like, and we need to break down that scar tissue. It will naturally break down on its own, but massaging can help it. So personally, I normally wait till about 6 weeks for the actual massage portion of it. But if you want to give it a bit of a moisturize, that's fine, Louise. Done that one. Do you have microneedling treatment for acne scars using dermaroller? Again, bit like what I was saying about the rhinoplasty thing. We don't do non-surgical, and that includes microneedling. For acne scars, there's another question in a minute. I'll Terry, long time no see. Kat is in the house as well. Nice to see you here. Amanda as well. See you all. I don't know if you've gone by now. I don't know. I should have said hello sooner. So microneedling for acne scars. I don't do so. That would be in the non-surgical arena, and I don't do this sort of thing. And I feel like, hello Terry. I feel like there are people out there who do it, a lot of it, and do focus on it. That's their specialty, just like breast and body's my specialty. Non-surgical and microneedling, and the other thing is subcision for acne scars. Treatment for acne scars is their specialty, and they can talk to you about all the nuances of all the different ways and how they all work, and show you maybe some results of before and afters, and I feel like I'm going to leave it to them, because, as I say, in this industry, particularly in plastic surgery, there's a lot of dabblers. We don't get it in other industries. You don't get it in cardiology or in orthopedics or in bowel surgery or in brain surgery or in liver surgery. Those are all done by specialists. No hernia surgeon would want to then just do some livers, and no orthopedic surgeon would decide to do a bit of heart surgery or brain surgery. So for some reason, well, I think we know the reason, but plastic surgery, cosmetic surgery, and plastic surgery is a subspecialty in its right, just like brain surgery, just like orthopedic surgery, just like heart surgery. It's a specialty in its own right. But for some reason, all sorts of people do plastic surgery and dabble all over. There's a lot of dabblers out there in the cosmetic surgery world. And one of the things that I have tried to stand for in my clinic is a no dabble policy. No dabbling. We've got a strict no, leave your dabbling at the door. We say, look, you want to dabble? Don't come in here. We don't want no dabblers, right? No dabblers. Dabblers hit no. Yeah, down there maybe there'll be some dabblers, but we don't do dabbling. So there'll be no dabbling going on. And so in my book, microneedling for using dermaroller for acne scars would be a dabble, and that ain't happening. So no, we don't do dabbling. So there'll be someone out there who is an expert in microneedling and acne scars and all that bits and bobs, and that is the person you want to go to. And hopefully that person doesn't also dabble and put in breast implants and tummy tucks, but they might well, because people do a bit of everything. Anyway, so no, it's a short answer. Yeah, no, we don't do microneedling. Louise, thank you and Merry Christmas, and with a Father Christmas emoji. Didn't know there was one. Louise, learned something there. Thank you very much. Oh, we got a theme. Do you know what? This almost looks like this has been planned. We got a theme because we got another question. Do you offer liposuction to the chin area? No, don't do that either. God, this is not a promotional video. This is it. Crikey, I've told you lots of things that I don't do. So liposuction to the chin area can be done and is actually very effective. It's a very effective area for liposuction. Just like any liposuction doesn't remove skin, but if you've got excess fat in the chin area, liposuction is certainly a very standard or whatever technique, but it is not one thing that I do because it's a dabble. And I've already referred to 5 minutes ago, I'm not a dabbler. So it's a dabble. It's a facial person's world that. It's up there with the rhinoplasties and things. So I don't know. Negative 9 niente. Jackie, good to see you tonight. So no, I do not do liposuction to the shin area. Very sorry about that. But again, there'll be someone out there who does faces. Just like I do breasts, there'll be someone out there who does faces and who does rhinoplasties and does liposuction to the chins and does facelifts and all the bits and bobs that go along with that. So so that is where I am. What I've got here, right back at you, Jackie. What I've got here is the last question I've got. Do you know last week? I can't believe it was last week. I just had my third jab. I did this. I was all right. I was in a right old state that night. I'll tell you. I had my third jab in the morning, Christmas lunch. Did this last Tuesday. Had to take Wednesday off, cancel the whole clinic. I was like I basically slept. Thursday morning slept as well. Got up about lunchtime. Did a sort of phone clinic on Thursday afternoon. Then was sort of all right. Friday I was all right, but couldn't believe it. I was sort of all right doing this. I felt bad cancelling the clinic, but to be honest with you, there was no. Oh, you went to me in, Terry, were you? Terry, I've got to be honest with you. I say I felt bad. I couldn't have done it. It was a no-brainer. I wasn't even wondering. Didn't sleep at all. I've already hurt my ribs here because I fell off my bike ages ago. This arm was where I had the injection. Couldn't lie on that arm at all. Did not sleep at all. Sort of like the COVID, because I had the COVID earlier in the year in February. Lying there. It's a Wednesday morning, Terry. It was a no-brainer. I had to cancel it. I'd have been no use to if I come in. You would not have been happy. I wouldn't have been happy. So I hope we rebooked it, Terry. Sorry about that. I cancelled the whole clinic. I don't know if that makes you feel better or worse, but it's quite a big clinic. I've heard there's some bad effects. Yeah, I've heard that when you have a bad reaction to the first one, you're gonna get a bad reaction to one of them, basically. I don't know if there's any science in that. Maybe I should be spouting science because I'm a doctor, but certainly I had no reaction to the first two. So the third one was a good reaction of me feeling unwell. But yeah, good luck with that, Terry. They're trying to get all the boosters done, aren't they? But I suppose it's good to get it done, isn't it? When you're a boosted person. But God, well, we can have another booster next year. Who knows? Yeah, fully done. In answer to the question on the table, do we offer subcision procedure at our clinics for acne scars? No, we don't, because that's a dabble, right? We don't dabble. We don't. Right. You know what I can do? Do you know what I can do? This is only on Facebook. I can do. Oh, it's not worth it, is it? Is it? How many people on Facebook? We don't dabble. No dabbling. Right. No dabbling. Yeah. We don't do no dabbling. So subcision procedure at our clinic for acne scars. So no. Again, you need someone who knows. Sounds bad. I was about to say who knows what they're doing. I mean, I could do it. I gotta be honest. I'm not convinced in it, because an acne scar is scarring, pulling the skin down, giving you that sort of indent for the sort of classic ice pick scar. And I know people do subcision. I guess it must work, but subcision is going to be cutting that scar tissue, letting that acne scar come up. What are you going to fill that space with? I mean, that's the problem. See, I do inverted nipple correction. Inverted nipples, the same sort of thing. The scarring has pulled that nipple down, has pulled those ducts down. Easy for you to say. But if you just cut the ducts, the nipple will come out. But if you just leave a space there, the nipple will invert again over time, because that space will fill with scar tissue, and that scar tissue will contract down. So therefore, you have to do something to fill the space underneath the nipple to hold it up. So that would be my worry about subcision. My worry would be that if you do subcision, which basically means putting a needle and cutting that scarring underneath the acne scar to let the acne scar come up, my worry is if you didn't fill that space with anything, that it would just scar down again. But I don't know, because I've got to be honest, it's not my thing, it's not my specialty. Someone who there is, I'm sure, someone out there who's doing it a lot, who's nuanced it and has got the technique off pat and knows exactly how to do it and can tell you whether it works or not. I don't know. So that is that's a dabbler, and we don't offer it. I don't know if it's effective or not. I certainly know it is a thing, but how effective it is, I don't know. I question the science behind it, because I would worry that space would fill with scar and put it down. But as I say, I haven't really, I'm not an expert in it, so you're better off talking to an expert in it. And maybe if they've got good results, and I'd like to see some results a bit longer term, because you can probably get some early results by just doing that. But the worry is over 3 to 6 months. If you've got a good result 6 months, I'd be happy that it might be worth doing. But anyway, we don't do it at the clinic. Why? I'll tell you why. That's why. Yeah. No dabbling. Yeah. We don't dabble, right? No dabbling at the clinic. We're non-dabblers. So what's going on here, Corinne? I got called for mine tonight. Oh, but going to wait till January now. I'm in isolation anyway. Yeah, isolation before the op, just to clear that up. Yeah. When patients, yeah. Yeah, Corinne. I don't know what to say about that, Corinne, but yeah, I was ill, and I've heard people being sort of ill for a prolonged time after these injections. So yeah, I guess I was lucky. I was just one morning and one day and one morning, but yeah, it's a bit of a worry, isn't it? When patients have capsular contraction with the normal implants, do they need to go for other ones or the same ones as before? Absolutely their choice, Terry. So probably what you're talking about is the difference between silicone and polyurethane. There are many surgeons who don't use polyurethane, so it is, in those people, it's quite a common practice to have a capsular contracture and have another textured silicone implant in. So yeah, you could go with the same ones as before. It has, we'd have to go through the same decision process because the polyurethane have got a lower risk of capsular contracture, and obviously when you have a capsular contracture and have that implant changed, your risk of getting capsular contracture second time is higher than it is first time. So you're increasing your risk every time because you're doing more scar tissue. But nevertheless, if you didn't want polyurethane, you wouldn't have to have polyurethane. You could go to silicone implants, textured silicone, or any implant you choose, really. And you just have to be aware of the risk profile with them. So, higher risk of capsular contracture, lower risk of ALCL, basically. What do you want? Do you want the one with a high risk of the ALCL or the one with a high risk of capsular contracture, or something in between, But yeah, you could have any implant you want, Terry, is the answer, once you've had capsular contracture, but your risk of capsular contracture is higher. So it might skew you more towards the polyurethane, but it's by no means a fait accompli that you have to have a certain type of implant. So that's that. Oh, nice one, Terry. Nice one. Save me. Have patients had capsular contracture with the other ones? Which ones? The polyurethane ones. Patients have had capsular contracture with all of them, Terry. So there's basically a spectrum. You've got smooth, micro-textured, macro-textured polyurethane foam. The ones of ALCL, yeah, polyurethane foam. So yes, they have, Terry. You can get capsular contracture with polyurethane foam implants. And the jury's a little bit out, but it looks like you may well be able to get ALCL with the smooth implants. So I don't think either of them 100% guarantee you of not getting that problem. So polyurethane don't 100% guarantee you of not getting capsular contracture, and smooth implants don't 100% guarantee you of not getting ALCL. But the risk is significantly less of getting capsular contracture with polyurethane and of getting ALCL with smooth. It's significantly less. So the quoted figures for polyurethane foam implants is 1% at 15 years, but that is for primary cases, which means first operation. Second operation, the risk is going to be higher. I don't know what the figures are, but you're not stuck, Terry. You are not stuck. You are fine, and you are fine. Yes. You're not stuck. But Terry, I'm sorry I cancelled your appointment on Wednesday. I'd love to see you. I hope they've booked you in another time. So yeah, I think they put some more clinics in because I cancelled the one last week. So hopefully we can fit you in. We can have a rap about it. But you're not stuck, Terry. There's always options. January, don't you worry. Yeah, good. And don't you worry, Terry. I think that's what you need to do. You need to not worry. Don't we all? Don't we all? So, Terry, thank you for that. Without further ado, I'm going to do some Christmas wrapping because next week is Christmas week. Let's be honest. This is like, this is rushed up on me terribly. And I'll see you, I guess, next week because I can't imagine I'll be doing anything else. And I will very much look forward to it. I hope you do too. If you've got any questions, please post them because it's just awful. I haven't got any questions. Not awful. I can make something up. But, next Thursday, that we're talking 21st of December. Is the dog okay? No, the dog's sadly yes, the dog's fine, Corinne. The dog has suffered no ill effect. And in fact, after the thing last week, I don't think it actually got any chocolates. Okay, I think it went for the chocolates, but didn't actually consume any chocolate. Okay, before I get any vet/dog person telling me how toxic chocolate is for dogs, it did not eat any chocolate. I think it went for the Quality Street, but was foiled in its attempts. So yeah, just clear that up. Is the dog okay with the Santa jumper on? I'm so pleased with the Santa jumper on. What? Deb, what's going on, Deb? Oh, good. Joey's here. Someone's here. There's life. There's life. Right. Oh, look, picture of a dog. Christmas jumper for Shizzle. What? For Shizzle? Is that for the dog? Christmas jumper for the dog? Yeah, well, I don't get involved with that sort of thing. All right, then. Shizzle Manizzle, I am going to check out of here. I suggest you guys do likewise. There's a lot going on out there. You know, the world is out there. So let's, you know, just enjoy the world. What we're doing here. I don't know what I'm doing here. God willing, I'll see you on Monday. God willing, Corinne, I will definitely see you on Monday. Looking forward to it already. And Facebook, love you big time. Instagram, big up yourselves. I'm going to check out of here because clearly I'm a busy guy. I've got a lot on. Thanks for coming and see you Monday, Corinne. And I'll see you, everyone else, Tuesday. Check out. End live. Facebook, where's the button? There it is. Take it easy, Facebook. Debbie. Thank you, Debbie, for being here. And Louise, thank you both for being here.